Hello again from quarantine. So this video we're gonna go over our fecal analysis slash parasitology homework. Okay, number one, why are diagnostic tests unreliable in detecting parasitism? If the parasite's not reproductively mature, then you're not going to see any eggs, which means you're not going to be able to detect it. So technically, you could have a negative fecal without when there's actually is some worms in that body. There are some serology tests for adult proteins, so maybe that those adult proteins aren't there because the parasites that are infecting the patient haven't matured yet. What are our most common parasites in dogs and cats? So that would be our roundworms or hookworms, whipworms, coccidia, giardia, tapeworms. We'll go over the scientific names down here at the bottom. What do we call roundworms, nematodes, in cattle and ruminants, and why? So we call them trichostrongyle type eggs, and that's because there's so many species that look alike and they're really difficult to differentiate. So we just call them trichostrongyle type instead. And the same thing in horses, we would call it strongyle type eggs. Like our UA, we should be performing a physical examination on feces, what are some of the things we're looking for? We're looking for consistency. So is it really hard? Is it formed? Is it liquid? The color can make a difference. Odor, like have you ever smelled a parvo diarrhea? The blood and what type of blood. So is it frank blood or is it melena? Is there mucus? Because mucus could tell us that there's a large intestinal issue. Or parasites. Sometimes we actually get to see the parasites in the stool. So your gross examination of the stool is pretty important. Number 5, name the different fecal analysis methods and briefly describe them. So we have our direct smear, where you would actually take the stool sample, put it directly onto a slide. We have our passive float, where we just mix with our solution and let float for 15 minutes. We have our centrifuge float, where we centrifuge for 5 minutes and then let it float for 10 minutes. And then we have our sediment, where we spin it down, and maybe if you're doing your centrifuge float, once you're done with that cover slip, then you can take all the supernatant away and check our sediment, because sometimes there's heavier stuff like our tapeworms that might be hanging out down there. And last but not least, culture and sensitivity. It seems weird to culture poop because, how much nasty stuff's in there, but we can check for growth of Clostridium because that is a common cause of diarrhea in our young animals. The sample size that we normally require is 1 to 2 grams, so it's usually about anywhere from a grape to a golf ball size. What's an advantage and a disadvantage to a direct fecal smear? So a direct can help us find stuff like tapeworm that might not float very well, but also we can find giardia with a direct as well. They're pretty motile in their trophozoite form, so you can see them moving around, whereas if you get them floating, they usually die or they're damaged or killed in the centrifuge, where you won't normally see them. In that case, doing a snap test would be more diagnostic, but we'll talk about that later. Our disadvantage is that it's such a small size that it might not be representative of the infection inside the animal. And what parasite is the direct smear most useful for? Giardia. Number 9. What is the specific gravity of most parasite eggs? And that would be 1050 to 1230. So 1.050 to 1.230. How long is a passive fecal float? 15 minutes. What objective do you review the slide at? So after you've done a float and you put your cover slip on top of your slide, you look at the 10x, which is giving us a total of 100x magnification. Number 12, we do not record a negative fecal as negative. How do we express our results and why? So we say there are no parasites seen at this time. And just like we mentioned earlier in this, if you get a negative fecal, it doesn't necessarily mean there's none in the body. It just means either we don't have enough sample size to see what we're getting into, or we don't have a mature parasite that's actually producing eggs. Number 13, describe how to perform a centrifugal fecal analysis and be specific. So just for this video purpose, I'm not going to be super specific, but you're going to mix the feces in solution. Sorry, I have been working all day, so my words aren't quite working, but we're going to keep trying, keep moving on. We're going to mix the feces and solution together to make your poop soup, and then you're going to filter through a gauze and centrifuge at 1500 RPM for 5 minutes. Remember to spin slow, just like we do urine. Add solution to create a meniscus and float it for 10 minutes. Then view your cover slip on a new slide. And number 14, how do we diagnose a tapeworm infection? Knowing that the eggs are normally too heavy to float in any of our solutions. So, we talked about doing a direct, we might see it, but technically the way that we detect a tapeworm infection would be from the proglottids reported from our owners in the stool. So they'll look like little pieces of rice in the poop. What are the two forms of Giardia? The cyst form and motile trophozoite. What does our SNAP Giardia ELISA test for? So next lecture we'll talk about our immunology and ELISA testing. For now, we're gonna talk about Giardia because it actually tests for cyst wall protein, where our ELISAs usually test for either an antigen or an antibody. Number 17, what can happen to an ova if it has been sitting for too long? It can start to larvate, and you'll see a picture of that in our next review. Number 18, what parasite causes visceral and ocular larval migrans? That's our roundworm or Toxocara. Which one causes cutaneous larval migrans? And that will be our hookworm. You can look at YouTube videos and see like children who played in sandboxes that got hookworms through their feet. It's pretty gross. So number 19, what are some artifacts we can find in a fecal analysis? So we've done the work, we've made the poop soup, we've spun it down, now we're looking at our slide. What are some things that look like could be parasites, but they're not? So like hair, pollen, ectoparasites, so sometimes little mites, maybe they came from the ground, or maybe they just traveled through the GI and made it all the way through. Sometimes hair can look like worms. Vegetation, so you can see grass and weeds. There's bubbles that kind of trick your eyes sometimes to think that they're eggs. And then fecal material, so sometimes there'll be just like kind of a clearish brown clumps everywhere, and sometimes it might be in a little circle shape that make you want to think they're eggs, but they're just artifact. So there's a lot of things to look at, right? Number 20, what are the most common locations of infection in scabies? So those you typically see lesions on their elbows or the tips of their pinna. Why might you see a mite in a fecal float? So the idea is that, maybe that it came off the ground from where the sample was picked up from, or a mite infection can be really itchy, pruritic. So they're chewing, and sometimes they just happen to swallow as they're chewing, right? So it doesn't mean that parasite can be pathogenic in the GI system. It just means that just happen to get swallowed, just happen to go all the way through and come out. Number 22, why do you need to perform a deep skin scrape for a Demodex sample? So I described this in our review video, but just to say again, it lives in deep follicles, so you need to scrape until you see some red blood cells, those little capillaries start bleeding, and knowing that other mites like Kitiella and Sarcoptic, they're more superficial, so you can find them with a tape prep. What do Demodetic mange mites look like? They look like little alligators. Demodex can be a normal flora found on the skin, even in humans. When do we see infection occur? So yes, we do have little mites, usually like on your eyelids or on your cheeks. You have little Demodex mites. And your immune system is able to keep them at bay and keep them at a normal population. Well, when your immune system is compromised for some reason, or let's say in our puppies that maybe their immune system isn't fully developed yet, then that's when you're likely to see a Demodex infection happen. What observation normally hints to an ear mite infestation? So our coffee grounds looking discharge, so it's really dark and gritty and like black, and it's really, really itchy. Number 26, how do you prepare a slide to examine ear mites on the microscope? So you're going to put some mineral oil on your slide, and then you're take your Q-tip or your cotton tip applicator and take some of that sample, and again, watch your hands. Sometimes they go to scratch you because it's really itchy. And then you're going to get some really good chunks and roll it into the mineral oil on your slide. And then all you have to do is view it at the 4X objective. They're pretty big. And you should see them swimming around in there and having a party. Number 27, how do you prepare a slide to view walking dandruff on the microscope? So you can do a tape prep. You would take like a clear packing tape, or they do actually make diagnostic tape, but let's face it, we're in vet med, so we use whatever resource we can, right? And then you just take the tape over the infected area and stick a bunch of stuff and then stick it on the slide and look at the microscope. It's that easy. Number 28, what bacteria is commonly found in dog and cat feces that causes intermittent diarrhea, especially in our young animals? Clostridium perfringens. And you can see that they are sporulating rods. So that's like your hint. If you were to do like a diff quick stain with a fecal, you see those little sporulating things, and it's Clostridium species. All right, moving on to our terms. So our pre-patent period is infection to detection. A host is an animal where the organism lives. A definitive host is an animal where the organism becomes sexually mature. An intermediate host is a host that the organism must pass through to finish maturing. Melena is black tar diarrhea coming from digested blood. HGE stands for hemorrhagic gastroenteritis, and if you were to see fresh blood, we call that frank blood. An artifact is an artificial structure that's not diagnostic. An ectoparasite is a parasite that lives on the outside, so that's our fleas, ticks, lice, mites. An endoparasite is an inside parasite, so our roundworms, hookworms. And a proglottid is a segment of the tapeworm that is shed in the feces. Then last but not least, our scientific terms. So these are your fancy words. Learn them now. Practice, because you're going to use them intermittently in parasitology. All right, let's get started. So number 1 is the canine roundworm. It's Toxocara canis. Feline roundworm is Toxocara catae. And there's also Toxascaris leonina, which looks similar but a little bit of a lighter color. And you can see that one in cats or dogs. Canine hookworm is Ancylostoma caninum. The whipworm is Trichuris vulpes. The coccidia is Cystoisospora. The canine tapeworm is Diploidium caninum. There's also the feline tapeworm is Tenia species. Bovine hookworm, as we said, Trichostrongyle type, because there's a lot of species and it's hard to differentiate. Equine roundworm, Paraascaris equorum. Ruminant tapeworm is Monasia species. So that one is pretty particular. You'll see some pictures where it almost is like a triangle-ish shape. That's kind of a cool one. So Monasia is your ruminant tapeworm. Your equine pinworm is Oxyurus equi. Your swine roundworm is Ascaris suum. Scabies is S. scabii, or a sarcoptiform mite. Ear mites are Ododectes cynotus. And the walking dandruff is Chylatiella species. I think that was my favorite. Chylatiella. All right, well, stay tuned. There's another video coming with your pictures to look at. Let me know if you have any questions. Bye.